We welcome you today and thank you for being here. We would like to first begin by acknowledging the traditional owners of the land on which we are all meeting from today. We'd also like to pay respects to elders past and present and emerging, and extend the respect to Aboriginal colleagues present. Would like to also acknowledge the elders of all the multicultural groups represented today and extend our thanks to everyone participating in this meeting. We would like to request if you can please keep your microphones on mute as we listen to the updates by Minister Hazzard, Minister Ward, and Dr. Kerry Chant. As we only have 30 minutes for the Multicultural Online Conference, please put your questions onto the chat and we'll try to get them answered from you. If you could put your name as well, then we can also acknowledge your question. If you have additional questions, please add them on. I will hand this now on to Minister Hazzard, which will be followed by Minister Ward. Minister Hazzard, good afternoon.
Yes, good afternoon, Jess, and good afternoon to all of the representatives of the multicultural media. Can I thank you for your ongoing interest in this campaign to try and stamp out COVID-19 and the support that you're giving New South Wales Health and the government to ensure that the messages get out to your community is just absolutely incredible. So thank you so much for all of that. Dr. Chant has just joined us, but before we go to Dr. Chant, I'm going to ask Minister Ward, Minister Natalie Ward, who is the New South Wales Minister for Sport, Multiculturalism, Seniors and Veterans, to just give us some very important information, which I think will be very, very strongly supported by the multicultural media. So, Minister Ward, can you hear me? You're not in the studio here, but you're online, I believe.
Yes, hello, Minister Hazzard. Can you hear me? I can be a little bit glitchy. There's 4 of us sharing the Wi-Fi here. So can you hear me all right?
We've got you, and I'm sure all of our friends in the multicultural media can hear you at the moment. So if you'd like to just give us the information that you think they would like to hear, because I know that's information I was very pleased to hear.
Thank you very much. And I also acknowledge the traditional owners of the land in which we meet and thank all elders in their communities for the wonderful work they've been doing. Yes, I also just want to start by thanking and acknowledging all of you, our critical multicultural media, for your support for our government, and particularly the wonderful work being done by Dr. Chant and all the health team and Minister Hazzard, your support in promoting and disseminating this critical health information. Multicultural media has been absolutely vital to ensuring that those messages get out to every corner of our communities at this very important time. In addition to the $2 million we've already spent on multicultural media outlets in this current arrangements, I'm very pleased to announce that the New South Wales Government is investing today. I can announce a further $2 million into multicultural media directly to support you in disseminating the vital health information that we need to get out to your communities, to our communities, to make sure we're reaching everybody through their own familiar channels in language. And I'm asking you to partner with us, as you have done so importantly so far, to get us to make sure that that information is getting to all of our communities in the language that they best understand, and so that they are aware of the health orders and what they can be doing to keep us all safe. And I'd like to invite you to give me any suggestions about further information or further channels or further ways that we can be doing that to support you, so we can walk this journey together to get the information to all of our community. To make sure we're reaching as many people as possible, we have so far translated our critical health messages into almost 60 languages. We have had intense community radio advertising, and I want to thank you for partnering with us in ensuring we get out through those vital community radio channels. We've had full-page newspaper advertising, and I thank the news and print multicultural media outlets for their critical work in that space. And we've also had a number of online forums. I just particularly want to thank our community leaders and our religious leaders for partnering with us in those community forums so that we can get information out to each of the communities. If I say something, it's one thing. If Dr. Chant and Minister Hazzard say it, it's another thing. But to hear from community leaders in language makes such a difference to those communities who understand and trust in their leadership. So I thank you for that great work. We know most people are doing the right thing, and we know that we can't afford to be complacent right now. So I want to thank you for ensuring that we can get that messaging out to all of our community, and that we're ensuring that we're guiding them at this critical time. So Minister Hazzard, I'm happy to keep talking about what we're doing if I've got a bit more information, if I have time. Do I have time to do that?
I think we might have to hold it there, Minister Ward, but I would just ask whether any of the multicultural media have any suggestions to Minister Ward, a quick comment or question in regard to any further assistance that you might need from her department, that is multiculturalism. So are there any quick comments or questions to Minister Ward?
While we're waiting for those questions, I'm very grateful to receive suggestions. We have done, and I just want to acknowledge Multicultural New South Wales has been very proactive and worked very hard to get those translations done. If there's additional work to do, please do let us know. We're working with all of our religious and community organisations to make sure that we're getting that information translated as quickly as we can, not only the stay at home message, but the get tested message and the other detailed health information as it evolves. I just want to...
Thanks very much.
Thank you.
Thanks,
Yeah.
Minister. Jess, are there any questions that are directed to Minister Ward?
Yes, thank you, Minister Hazzard. Minister Ward, thank you, Minister Hazzard. I'd just like to ask if you could please, there's someone sharing their presentation on screen. If you can please stop sharing. Extra information, Jamel, if you could please stop presenting. Thank you so much. We'll begin with some questions that we received online from the journalist. It's from Hadil Saba, a TV reporter from Iraqi TV in Australia. Thank you for sending your question. The question is, I live in Fairfield area. Is there a possibility to provide vaccine in Fairfield's showground for general community of Fairfield or Fairfield community now in need of getting vaccinated urgently? And I already took Pfizer 16 days ago. Hadil, maybe what we'll do is we'll ask when any suggestions for answers for that. We will get that through to you, Dr. Minister Hazzard. Minister Hazzard, you're on mute.
No, I'm not, unless somebody else did it to me. Okay, thank you. I'm not in control of my mute button. Somebody else decided to mute me. There's a lot of people who would like to mute me, actually. Could I just say that there would appear there's no questions directed to Minister Ward at the moment, so we'll deal with the health issues. Look, first of all, can I just say that thank you to Hadil for that question. Obviously, there are challenges still, Hadil, in regard to the supply of vaccine coming in from the federal government. But I'll ask Dr. Chant, who has just joined us, whether she might be able to assist and give a very short medical answer to that. We'll try and keep the answers short so we can have as many questions as possible today. So just repeat, you know what that question was?
Yes, certainly. So look, if you've already had your first dose of Pfizer, you will have been booked in for your second dose of Pfizer, and we encourage you to promptly get that second dose. The 2 doses provide good protection, and even 1 dose does afford some protection. In terms of your community, I would be saying that there are currently bookings available that they can go through a number of general practitioners. So if they go onto the Commonwealth website to look at the eligibility checker, they will find a number of GP practices offering AstraZeneca vaccine. And certainly, as Minister Hazzard's indicated, that as we receive doses of Pfizer, we will be prioritising it to many people in the communities of southwestern Sydney and particularly the Fairfield local government area.
And can I just stress, if you'd like more information on all of the questions relating to vaccines, you can go onto a very good one single source of truth, being nsw.gov.au, nsw.gov.au, and it sets out answers to a whole series of questions around vaccinations. But I stress, vaccine supply is still not great, particularly in regard to Pfizer, but we're expecting a lot more Pfizer towards the end of September from the federal government. So at this point, we just have to do what we can. But if you're over 40 You can certainly now, on the basis of the health advice the federal government have given us, look forward to having AstraZeneca, which is what I had. And you can book with various GPs who provide that. There aren't a lot yet, but there are some that are providing it, or you can go on to our health website and book to try and have AstraZeneca as well. And of course, if you're under 40, that's still a possibility, but you really need to be talking to a GP so the GP can weigh up all of your various medical issues. Can I move to the second question, Jess?
Yes, thank you, Minister. Raj Natarajan of Oz Indian Media has a question. When Avalon cluster was growing, only the North Shore and Lower North Shore residents were subjected to hard lockdown. Why not the same strategy for this wave when only Southwest Sydney seems to be the hotspot, whereas the whole Sydney metro is under hard lockdown? Why a different strategy when the previous one worked successfully in containing the spread?
Thank you for that, Raj. Raj, the Northern Beaches one was a little different in the sense that it could be isolated. There are very clear boundaries there. I live down that way and there's basically only a couple of streets in and streets out. So it was very easy to have the police sitting at the top of Roseville Bridge and Monavale Road and to be heading off any people who decided to go in or out. We just have a different situation here with the current area that's of focus. So, and we do have cases currently across the whole of Greater Sydney area, whilst obviously our particular focus is around the Fairfield local government area and more broadly in parts of Canterbury, Bankstown and Liverpool. And we need to be really alert to those areas. And if any media listening to this in those areas, please get our message out that we need people in those areas to be very aware of the need to stay at home unless you really need to go out for medical reasons or for work that you can't do from home. That's the big difference. Next question, please.
Yes.
Could I just add one more message there that the media really needs to, we've heard that this wasn't well understood, is when we say stay at home and no visitors to your home, that means anyone from another household. So we're aware many people see almost their aunts, uncles, nephews, cousins on a daily basis and almost conceive of them as they are their family, but they conceive it as their extended household. What we're saying to protect us from COVID is it's just the people that usually live in the house have to stay together, no visitors from anywhere else into the house.
Okay, the next question, please, Jess.
Yes, Susan Harani, Radio Tomorrow of Salvatad. Our listeners pointed out that there is pure messaging and big lack of communications in terms of the lockdown, essential workers, COVID testing and vaccinations. People were told 1 a.m. they should provide proof to their employers or police that they got COVID test if they're essential workers from Fairfield and want to attend work. They're furious and saying that they don't have the information. How could we answer that, Dr. Chant, Minister?
So just to reassure your communities that the testing requirements we always have a sort of, it's for the Fairfield local government area for people there. They're given some time and that was, we always have some phase-in period recognising that it does take time for people to attend. I think we could have done better messaging and I apologise to the community for the impact on them. But what we're also wanting to get across is if you've got to go outside to do your work outside the Fairfield local government area, get tested outside the local government area, because certainly we have seen the turnaround times in Fairfield were impacted because the community responded, and that was just such an amazing thing to see. But we certainly need to make it easy for people to get tested regularly. And we are expanding services both within Fairfield, but also giving them the message that if you're driving across to another part of Sydney, say Western Sydney, there's lots of testing clinics there with very little wait. So please just look where you're going on your way, on your drive, or at your destination. Choose sites that make it really easy. And we thank the cooperation of the community. The real purpose of this is to identify any infections that are missing quite early, and also to protect the people in Fairfield, but also to protect any seating outside.
Can I add something? Can I add something? It's just, it has been said that why people in Fairfield feel that they are discriminated because a lot of people do come in and work in Smithfield and in Fairfield area, and they're not asked to do the test, and they work for 8 or 9 hours per day. They feel a little bit discriminated regarding this. And I've got another question also to Minister Hazzard. Minister, our Premier said last week that no state can endure the Delta strain and be able to live with it within the community while the rate of vaccinations is at 9%. Since vaccination is the key role to fight COVID-19, why not make vaccination in Australia mandatory to all adults?
So can I just answer that question about mandatory vaccination? So we actually have made vaccination mandatory for aged care workers and a number of other critical settings in our quarantine services, people that are at very high risk of exposure or where the consequences are high. Unfortunately, we don't have enough vaccine. We don't have enough vaccine in the terms of the Pfizer vaccine, which was recommended for younger people. And so until people have that, we have that in ample supply, there is not really vaccine hesitancy. I mean, I know we talk about vaccine hesitancy, but the experience in Australia is that the vast majority of people will take up vaccines and follow the recommendations. When you look at us internationally, we have one of the most highest childhood vaccination rates. And I think anyone would say, you know, parents are most thoughtful about their children. And so I think that's a good indication that we are not in the main a vaccine hesitant community. It's really about making it easy to get and having adequate supplies. And we do not have that situation at the moment in terms of the supply.
And can I just say, Suzanne, in terms of people feeling like they're being targeted in that area, can I tell you, I came from the Northern Beaches, and I think we felt a bit that way about Christmas, but we also recognised that we just had to have special arrangements in that area because we had cases in that area. And about 3/4 of all of the cases that are arising at the moment are in the Fairfield LGA. And of those, about half to 3/4 are actually very, very associated with the wonderful families that extend across that area normally, but perhaps weren't aware that they needed to really just leave one household away from another household. Families move around a lot in Fairfield. We're certainly aware of that because of the strength of the multicultural community. But we had to make sure that, and even today, 3/4 of all the cases were to do with families in the LGA of Fairfield. So, but we're getting there, and I think hopefully families are with us on the journey. We'll get there. Next question, please, Jess.
Minister, I just wanted to say thank you for all the comments, and chats. People have thanked New South Wales Health, Multicultural Health and Communication Service and Multicultural New South Wales for holding this event. Thank you very much for that. There's been some comments that ethnic media is happy to support and is the best way to reach the communities is radio. We've got a question from Stephanie C. from Vision Times Media Corporation. When will the international students return to New South Wales? They've waited more than 1 year, and some of them has transferred to other countries. What will the government do to keep them still interested in Australia? That's a question from Vision Times Media.
Thanks, Stephanie. Look, our government, our New South Wales government, is very, very keen to get students back into New South Wales. They bring a vibrancy and an energy to New South Wales. We love the fact that they're there because they give us all of the things that they bring the world effectively to our doorstep. In addition to that, it's good for the young people, good for the students, and it's also good for our community, both socially, culturally and economically. We have plans that have been developed to bring students back, to move them through smaller groups first, and then we've been working with the universities, the colleges and so on. We had to get approval, of course, from the federal government because they're the government that determines the number of people coming into Australia at the present time, whilst our borders are notionally closed. They're limited in the number of flights. But I can tell you that Premier Berejiklian and the Cabinet and the government generally are very keen to get students here. So we'll be doing that as soon as we can. I've got to say we were on the cusp and we've been a little interrupted by a virus called the Delta variant, and it slowed us down just a few weeks, but we'll be back onto that as soon as we can sort this out. And that hopefully won't be that far away. But thank you. Next question, Jess.
We have a question from Fred Zhang. Where in a lockdown and people are supposed to go for essential shopping only, but lots of other retail shops are still open. Do you think the situation like this should be considered in lockdown policies too, where people should have a final lockdown because of this?
Look, we think that the lockdown now we have is a hard lockdown. Obviously, every state and territory have different ways of dealing with these issues, but our government's always tried to strike a balance. And if we infringe on our citizens' normal entitlements to move around, we do it carefully, very carefully. And what's essential for one person may not be essential for somebody else. The Victorian government did actually define what was and was not essential. And I get on very well, as does my Premier, with the government there in Victoria. And the discussions I had as late as yesterday with the Victorian government indicated that when they tried to define what was essential, it was very, very much a problem, because what is essential to one person is not essential to another. So, for example, if you're living in a house and you're an elderly lady by herself and you get a flood, you know, the pipes break and your bed is destroyed or your lounge is destroyed or your TV is destroyed, you need to be able to go and get a new bed. If you're a new mum with a baby, you need to go and get what you need. If you're, you know, there's a whole range of topics, and we're not in the business generally of saying to people, you should go to this store like Target or Kmart and not David Jones. But the short answer is we are saying to people, stay home. Stay home unless it's absolutely essential to you. We're trusting the community. I think the community trust us, we trust the community. And that's been the measure and the model that we've taken. And I've got to say, I've just come out of a meeting showing people moving around, and we can do all that through the various methods we have. And of course, use of, you know, finance, cards, credit cards and so on, transport. And what we've seen is a massive reduction in the mobility, the people moving around, particularly in the area of Fairfield local government area. So we just want to thank them for doing an amazing job. The community are with us and we don't want to alienate the community. That's not the way we work. Next question, please, Jess.
Thank you, Minister. We have a question for Minister Ward about translations for Minister Ward. Pawan Lutra from Indian Link has said one of the issues with translations is how formally some are done as compared to colloquial language use in everyday talking. Having factored this in will help in making sure people are listening.
Yes, thank you very much. I appreciate that feedback, and we have had some of that already. Multicultural New South Wales has worked really hard to ensure that we are getting these messages out to people in language, and I know that there are a number of nuances, and we appreciate your feedback on any of those that we can help with. We particularly have worked hard to ensure that we get community leaders to be doing those translations as well, so that they are going out from people that they know and see and hear in their own communities. So that's been important too. But I thank you for the question. I'll take it on board, and I know that Multicultural New South Wales are working very hard to make sure we're getting across all of the different nuances of different languages and colloquialisms as well. Thank you for that.
Mr. Ward, Jess.
Yes, thank you. Violi Calvert from Radio Tagumpay has asked, what is now the count and percentage of New South Wales population who's received vaccination of one dose, received full vaccination, and what was the issue problem that caused people being turned away from any vaccination hub in southwestern Sydney?
Dr. Chant.
So I think the total two-dose vaccinations around 9.6% of the population. I'd have to get you the other vaccination, but ultimately the vaccination levels are not sufficient. It's pleasing to see that they are higher in the over 60s, but a key message I'd like to get out is that particularly people over 60 should urgently make appointments to get vaccinated.
Next question, Jess. Can't hear you, Jess. You're gone muted.
Yes, everyone, as also thank you. Please take care. this is great messaging from everyone to take care and to also just supporting this. There's a question about, given what Melbourne has gone through of the past, what are the lessons that we've learned here in New South Wales and what are we taking on board?
The lessons we've learned is about community and how each community is different, and we really need to work in partnership with community. Community leaders, community radio, community media, community businesses. It is just so critical. And I think unless you've got to have the macro settings right, but ultimately it is around working with community so that they understand what you're asking them to do and that you make it easy for them to do that. And that also goes to government's role in supporting the impacted communities through financial support, through food packages. And so we really do need I think the lesson is you need a whole of government response to tackle such a complex issue.
Jess, next question.
There's a question here from Desi Australia. One of our readers from Desi Australia reached out to us asking if his 80-year-old father lives in different address and is booked for his first vaccination with his local GP. Can he go to his place to his father for vaccination? This is from RT Banga. And I think these are some...
If the question is, can he go to his father's to assist him to go for the vaccination? Yes. The answer is yes. There are, obviously the basic rule is stay at home, stay at home, stay at home, don't go. And if you can talk to your parents or others because you want to keep them safe, we'll do it by phone or by some other media, audio, visual, Zoom or something like that. But you can actually, if it's absolutely necessary through care or compassion or to help with medical things, of course you can go. But of course, do it in such a careful way. Make sure you wear your mask. Try and just use all the COVID safe measures that we've come to know and try and just keep him safe and you safe as you take him to the medical appointment.
Thank you, Minister. A question from Adriana Simas from Greek Herald here. Many of our print readers are elderly, and during the lockdown, we find this group impacted by loneliness. The most of us are separated from our families. We've been offering home delivery to ensure they're receiving the news. What else can we do to support their mental health?
Mental health? Looks like Minister Ward wants to answer it if we can do it quickly because we've only got 2 minutes.
I'll be very quick if I may, and just picking up on Dr. Chant's point earlier about community and Minister Hazzard's point, there are mental health packages, but also through Multicultural, we have announced last week, and I encourage everyone to apply for support grants for immediate relief for multicultural organisations, community organisations, to assist them to get that support out there. So that's part of an overall package. There's up to $250,000 available to provide immediate relief and the current restrictions, and that's to support people doing exactly what they're doing, the volunteer food banks, the hamper delivery service, the free meals, and the programs combating social isolation. So those grants are there. Please apply, because the community groups that know their individual communities best are best to roll that out, and we encourage you to apply. That's open till tomorrow, so please get online. I know many of you have already, but we want to help you and give you the support to do what you do best in your communities.
Community groups can certainly leave care packages. They should do it safely and carefully. Leave it at the front door if you can. If you're a family member, still the same thing. The most loving thing you can do to keep your family safe is not go into their house at the present time. But if for mental health reasons or others you must, then we strongly suggest you do it perhaps out in a balcony or outside in the fresh air, because we know the virus transmits the least in that situation.
Thank you, Minister. And we only have 1 minute, so we have one question here from Tiam Hock. Can we have more GPs doing the vaccination and also testing, because GPs know our bodies from head to toe? This is from Tiam.
Certainly the testing probably is primarily to be done through the testing facilities. Drive in and get them done, because it can be done. GPs need to be able to focus on their normal practices and look after their patients. So principally still go to our testing stations. But in terms of actually getting the vaccines, yes, of course, contact your GP and see if they can give you the vaccine. Most of them will be able to give the AstraZeneca. Some of them will be able to give the Pfizer. Can I just finish by saying thank you to all of the multicultural media who are online again. We'll do this as often as you would like it. But our big two messages, if you could possibly get these out in the next couple of days, is stay home, stay home, stay home. It's the only way to keep your family that you love safe. Don't go to your families unless you must, absolutely, for very critical reasons. Don't do it. Talk to them on the phone, do other things. And the second thing is, and I think this is where we started, or the second question anyway, if you're a worker in the Fairfield local government area and you're going out to work, which most of the folks in that area do, then please get tested once every 3 days, but you've got until Saturday this week to do that. And don't do it in Fairfield. Leave the Fairfield area for the people who need to get tested because they've got symptoms or their medical people have said to go and get tested. If you're well and you're leaving for work, get tested somewhere closer to work because it's just a check-in, basically. It's checking that you haven't picked it up, and it's just that extra check. So you can go to any place, anywhere in Greater Sydney and get tested on the way to work or on the way home and try to do it every 3 days or so. They're the two big messages we really need out of today, if you could all support us in that so much. I appreciate everything you're doing. Thank you so much. Dr. Chant, any final message?
No, that's all right. And just thank you. Get those messages across, and also any suggestions gratefully received about any ways we can better We're interested in also some feedback on thinking about digital files, because a lot of people, the feedback we've had is people listen orally, listen to messages better. So any ideas, any innovations, any thoughts, please send them through.
Send them through to Multicultural New South Wales. We'll make sure they come to us because Multicultural New South Wales are the group that can do that. Can I thank you, Jess, and everybody who put this together, and all of our multicultural media friends. You actually are the front line in the next few weeks. We really need you to be 100% with us on this, and I'm so grateful. So thank you for everything you're doing.